Hey everyone, and welcome to the Happy PharmD podcast. I'm really excited to have everyone here again today for another episode. Today we will have another one of our Happy PharmD coaches joining us to learn more about herself, her career, and her philosophies on coaching. Very happy to welcome our guest, Lynsie Wokasch, to the Pharmacy podcast. All right. Well, welcome everyone to the Happy PharmD podcast. Today, I have a special guest, one of our newest Happy PharmD coaches. Welcome, Lynsie Wokasch. Thank you so much for being here on the podcast today.
Hey, thank you. I'm excited.
Absolutely, me too. So let's just jump right in. For everyone, if you could provide us with a brief bio about yourself, where you're from, where you went to school, and then walk us through your career path and where you are now.
Okay. So my name's Lynsie Wokasch. I am born and raised in North Carolina. So one disclaimer I always give out is I use the word y'all a lot. So if you hear it, I have a hard time not saying y'all. But I was born and raised here in North Carolina. I live right outside of Raleigh now. I'm married. I have 2 kids. And I went to pharmacy school at Campbell University, which is in a very small place called Bowie's Creek, North Carolina.
Very cool, very cool. And where did you start off your career when you graduated?
So I started with CVS. So funny story, if we kind of go back for just a minute. So I had a cousin who was a pharmacist, and when I was in high school, she drove a BMW and she lived at the beach. And I was like, I need to know what she's doing for a living. So at 16, I actually started working in a hospital as a pharmacy technician. So this was a long time ago when you could work in a pharmacy without having graduated from high school. So I started working in a hospital when I was 16 years old. So now we're sitting here and it's 20 plus years later, and kind of been in pharmacy since then. So I started out with CVS straight out of school as a staff pharmacist in Smithfield, North Carolina.
Very cool, very cool. And then as you went from there, I guess in terms of how was that for you, and then what kind of transition did that lead you into following that?
Yes, I had a really kind of good career, a fast sort of pace once I started. So I did 2 years as a staff pharmacist, and then I did 2 years as a pharmacy manager. It was a 24-hour location, and at the time we were doing over 5,000 scripts a week. So it was a really high volume store. And I kind of always knew that I wanted to move up. I remember when I first graduated, I was at like our grad intern conference, and I told one of the pharmacy supervisors, I was like, I want your job. And so that was kind of what my plan was really the whole time. Like, again, I had been in pharmacy since I was 16 years old. I had done hospital, and then I had transitioned over to retail. And I felt like I had a really good grasp on retail pharmacy and what it took to deliver really good patient care and customer service and like the operations of it. And I knew I wanted to be the person that was helping other people learn how to do that. So when I was a pharmacy manager, when I had gotten promoted for that, I got a new pharmacy supervisor, and he was really all about the legacy that he was building. So, and a very important part to him was about the people that he was bringing up and training. And so it really just worked out really well. I mean, that's what I wanted to do. And his whole goal was being able to train somebody and to teach them about pharmacy. And so honestly just kind of like locked arms underneath him, and he ended up being promoted to a district manager, and then that had a pharmacy supervisor position open, and then I got promoted as a pharmacy supervisor. So 4 years out of pharmacy school.
Wow, that's very quick. And actually, I could say I guess I could say I stole your line since I graduated after you. I said the same thing when I was when you did the interviews right before graduation and everything like that. I said the exact same thing. And then so I know you did that for a decent amount of time. And then tell me about your transition from there to your current role.
Right. So I was a pharmacy supervisor for 7 years. And then CVS restructured and I became a district leader. I did that for 2 years and I actually left. I resigned in October of 2019. And then in March of this year, I joined a long-term care pharmacy. And so I'm a consultant pharmacist for them now in long-term care.
So it's quite a difference there. How would you, in terms of those out there who maybe are interested in making some type of transition like that, how can you describe or reflecting on it now, the change in like maybe the work-life balance or just obviously the role is a lot different. How can you depict that in terms of when you look back at it, how much different that is from back in retail or that type of field to a totally
My
different
role,
one?
sorry, my role now is totally different. When I was actually with CVS as a pharmacy supervisor, I did not, I don't know, I guess I didn't even envision the job that I have right now. Like, I did not know that this type of position really existed. It is work-life balance is actually something that's very obtainable with this new role. I really enjoy getting back into the kind of the clinical aspect of everything. And then I'm still getting to keep that kind of travel and being able to work with different teams because I'm able to go and visit different facilities and work with those teams at the different facilities. So that's where the roles of like the supervisor role and this one kind of marry up. It's a totally different experience and it's been very, very good so far.
That's wonderful. No, I was for a lot of people, I think that's like kind of like what you said. It's hard to imagine, where you're going to be in 5 years until you're there, right? Unless you kind of do that self-reflection and really try to think about what it is that you want to do, right? And I know right now you're also, I guess you could say, another role with coaching. So tell me a little bit about that and your thoughts about coaching and why it's so important.
So I guess with coaching, I had actually followed Alex on LinkedIn for quite a while. I was kind of interested in what he was doing, especially since I sort of experienced that leaving retail and going to a different field. And honestly, it's probably what I miss about my previous role the most is really working with pharmacists and helping to kind of coach them either in their current role or, teaching them and training them how to do new things. And so this role really kind of gives me the opportunity to be back working one-on-one with pharmacists, which is what I really enjoyed doing whenever I was in my previous role.
No, I can 100% relate. And in terms of, and I feel like a big thing with coaching, I guess I'll back up there. I feel like back, when we were in school, when you were in school and when I was in school, even, coaching was still actually probably not even a heard of thing in terms of in the field of pharmacy. I feel like it wasn't a very known thing. Obviously there's business coaching and career coaching, but you never think of it specifically for pharmacists, right? So I feel like it's still a pretty new thing, but for those out there that are kind of ambivalent on maybe signing up for it or thinking as pharmacists we're very stubborn already and try to figure out our way through things on our own. That's kind of how we were taught and how we're just that's how we are. How would you recommend or advise someone who maybe is on the fence or considering getting into coaching?
I guess I'll just kind of say that when at the beginning of 2019, when I was starting to think about that I wanted to leave, I actually worked with a life coach. So people may be familiar with life coaches, like you said, kind of this career pharmacy coaching may be a little bit different, but from my personal experience, it really is able to help kind of um, get the clouds out of the way so that you can see really clearly what it is that you need to be working on. And it's somebody to help kind of keep you accountable as well for what it is that you kind of want to do and are planning to do. And I think for a career coach, it's that same thing. Being able to have somebody who's able to come in and really help you define, okay, what is my career path like? What are my strengths? What are the things that are going to bring back purpose in my career in pharmacy. And then sometimes when we have that self-talk in which we forget those things, it's really helpful to have that coach to remind you of those things again. You know, looking for a new job, and especially if you're like changing career fields, can be a very scary experience. And you know, you need somebody sort of in your corner that reminds you of what greatness you have and what your purpose is and what it is that you really like to do. And then that person helping kind of keep you accountable to those things can really help you define what your next career step looks like. And then also help kind of coach you through how you actually make that transition.
Yeah, absolutely. I feel like, having someone just to hold you accountable at number one is huge. It's also like, I feel like it's one thing to be like, I'm going to do this and make a plan, but if you don't set a time, or if you don't have someone who's checking in on you and, hey, like, when is this going to be done? Is it done? and so forth, and holding you accountable is a huge difference. And I think also, I'm looking back at a couple things you were writing. I think one of your big things is, I think you said you're a big sports fan. Is that a big philosophy that you bring into things?
So I'm a huge sports fan. Um, and I kind of normally say, like, sports explain life. If almost in every scenario, I can come up with a sports situation or an explanation that involves sports, to kind of help explain things. You know, even just talking about a coach. So if you're thinking about a football coach, that football coach is identifying what the strengths of the people on his team are, helping kind of figure out, okay, where are those strengths going to work best in the plays that we're doing, and helping hold that team member accountable to what they need to be doing in order to better themselves. But at the end of the day, the coach never gets on the field to play the game. That is the team member that's getting on the field to play the game. And so when I'm thinking about like coaching somebody, that's what I'm here to help you do, is identify what your strengths are. What are the things that we can do to strengthen those strengths? Where would those strengths fit best in a career goal? But at the end of the day, I'm the coach and I'm on the sidelines. So I'm not the person who is actually going to be putting that in motion, but I am there to help kind of guide you on what that looks like.
I want to assume that I guess you already kind of said it, that you use that with everything, right? I love that analogy that, in terms of, at the end of the day, they're not the ones actually on the field. That's a really cool way to look at it. And in terms of, I kind of want to go really back really quick to, and how long was it that you had a life coach, and you said exactly when you started that again?
So I did 6 months with a life coach.
Okay.
I know our coaching program is 3 months. The life coach that I had, again, it's a different program. I mean, it's the same sort of principles, but it's a little bit different. So I did 6 months with the life coach. And a life coach, what is a little bit different is you go into really all aspects of the different parts of your life, from health to maybe your faith. It can be like your marriage and your parenting, and it really kind of goes into all of those aspects, including, to a certain degree, your career. But we didn't focus specifically on career like we would do as a Happy PharmD coach. And that's, the length of the programs maybe kind of differ a little bit because of that.
Gotcha. And I guess just the only reason I bring that up is because you've been through a coaching program in general, right? So I guess you've kind of seen the benefits of it, right? But I think you brought up as well that you're a very honest and open person. So I'd love to hear a little bit more about that and how you kind of bring that into coaching, and your thoughts on that. You're already laughing.
I'm laughing because I say honest and open, but the reality is I'm very direct. So I say what I mean, and you can trust that what I said to you, I really mean. I hate the back and forth of, well, what exactly did that mean? And were they saying I should have done this, or were they saying I should have done that, or, that cloudiness that comes sometimes after having a conversation with a coach or a manager. And so I try to be very open and honest, direct, really, in the things that I say to somebody so that there's not questions coming back from that. And what I find is that it's a really good way to build trust. Because when I say that I'm direct and open and honest, sometimes it may not necessarily be the feel good things that I'm saying. I want to say those things, but sometimes it's hard conversations that you have to have. But it really builds trust between the person that I'm having that conversation with, because they know that I'm going to give them honest feedback in every situation, and they don't have to question what my motivations are or what my intentions were with that conversation.
100% agree. And I think sometimes it helps someone much more instead of, I guess you could say sugarcoating something, but just being honest and being direct and telling them, how it is, right. And helping them to, at the end of the day, your goal is to help them, right. You're not trying to, keep them, you want them to grow. So the biggest thing is to help them expand and move forward and possibly see things a different way that maybe that they're stuck at seeing, and just trying to see outside of the box and move their vision forward. But in terms of, with coaching in general, I feel like right now, especially with COVID, everyone listening, right now it is December or almost end of December already. Can't believe it. But, with COVID, seeming to get even worse at this moment, with the vaccine coming out or out in the moment, but slowly being distributed. How would you describe the importance of coaching right now for those who maybe, are even more hesitant to do coaching just because of the time and curious or worried about there being enough openings or anything like that? What are your thoughts on that?
So I think that number one, if you're interested in it, then the time really is now to do it. And I think even if whenever you get in and you see the Happy PharmD program, the best time to start this program is honestly when you're probably not even looking for a job. It's really good to do it when you are looking for a job. But like if I had known all of these things back before, they would have helped me so much. Like all the networking pieces that are part of it, all of the really being able to look and define, what are the parts of your job that you get the most joy out of, that you're really the best at, being able to kind of identify those things, learning the networking pieces. I think it just opens a lot of doors that are probably not necessarily being opened if you're not familiar and already using those tools. Um, I know that like the networking piece, I was very networked within CVS, right? So I knew everybody at CVS. I was there for a really long time, but I didn't really network a whole lot outside of CVS. And I quickly found out that was a huge opportunity that I had, that I needed to really work on. For example, too, like how I got this job was through my network, was through somebody that I had worked with CVS. A position was open and they kind of recommended me for it. So I think, you know, all of the things that you learn in the Happy PharmD program and the processes and things that you go through with it, they're really just helping set you up for a really long career and being able to really know what is the right trajectory for my career. Like, what direction am I truly trying to be in? I mean, I am a person who's always thinking, like, what's the next thing that I can do? What's my next step going to be? And this program, I think, helps you really be able to clearly define what those things are and already be able to put in place the things that you need, so that that next step comes at the right time and those opportunities start to open up versus you kind of sitting back and waiting for it to be the time that you have to make a next step, if that makes sense.
No, 100%. And I feel like, you hit the nail on the head there. Like, networking is huge. And I feel like, you go back to pharmacy school or in general, if you did a residency or anything like that, it wasn't something that we were really taught how to do. Or, in general, it's not something that there's not a class really on it. There's no networking 101. And I feel like it's something that, you kind of get tossed into. But I feel like having that accountability partner and, having a coach to kind of walk you through the steps and also kind of show you, put you in the right direction, makes a huge difference. But you're right, though, networking is a huge aspect of any kind of, even just in general, whether you're looking for a job or not. It's very beneficial, right? But I feel like even during right now, during COVID times, it may be even easier to network with, with people, just because a lot of people are working remotely. That commute time that they usually would have, whether it's, 30 minutes or an hour of their day, or the time they needed to get ready in the morning before work or after, they have more time. Typically, depending on if you have kids or not. So if you have kids, you may have less
Right.
time, right? You could tell me more about that, because your kids are in school of age. But in general, I like to think that people may have a little more time right now to network, and it may be more beneficial, even better time than normal. Um, go
That,
ahead.
and two, I think an advantage of this time is that pharmacists are truly in the limelight right now, right? Like, so with the vaccine, and that pharmacists are the ones that are administering the vaccine, and pharmacies are um, the ones that are kind of getting the vaccine and then being able to distribute it. You're just seeing a lot about pharmacists and the pharmacy profession. And I think it really just opens up doors. I mean, I've had conversations with people about, tell me exactly what it is that you're doing with the COVID vaccine right now. So, what is happening at your place of business with the COVID vaccine? And it's not necessarily just related to like CVS and Walgreens giving the vaccine, but also, like in mine, I'm in long-term care pharmacy. We've had to go through the whole process to register with the federal government, to register with the individual states, to make sure that we have everything operationally set up within our pharmacies. So I just feel like it's an open door to have more conversations with people about their job and what it is that they're doing, and especially kind of related to the vaccine, when pharmacy seems to be kind of in the spotlight right now.
No, absolutely, 100%. And I feel like, as the vaccine becomes even more further distributed, and it affects, more and more of the population, because obviously right now, you're in long-term care, so you're seeing it, right now in the beginning. And it's just going to continue to affect more and more pharmacists. We're all going to be directly involved in this with our patients, whether or not you're treating a specific population of patients, or the general public. But very good point. I like that a lot. What I'd like to also kind of go into is, if you had to summarize for someone the overall benefits of, coaching before and after, what would be like the top three things that you would say?
So I'm going to go with accountability first, because I think it's very important to have someone that's helping hold you accountable and being kind of a partner with you in that process. The second thing I think is really being able to identify who you are as a pharmacist and what your strengths are. I think it's really, really important to remember who you are and what you're good at and what those talents that you have are that somebody else doesn't have. And it's very easy to lose that when you're in the day-to-day grind and maybe in a position that's not necessarily using those talents. And I think this program and coaching in general, that helps you identify those and remember them, and you have a coach that helps make sure that you are identifying and remembering those things, is invaluable for your career. And I think the third one is, we have a lot to be proud of as pharmacists. And, the pharmacy industry as a whole right now seems to maybe not always being looked at in a positive light, especially with pharmacists themselves. But I think this program helps you see what other paths there are and know that you're not necessarily stuck in one place, that you can be very creative in what your next career step looks like. You can be an entrepreneur. You have the ability to find that position that's really going to help you fall back in love with the career that you chose.
I love it. I like all three of those. Great answer. I know I put you on the spot there.
Yeah, you did.
But I'd like to, as we're wrapping things up, I kind of want to switch gears back to where we started, or I guess technically where you are currently in your role. For those listening out there who don't really know what it is that you do in your role, can you describe just, a quick summary in terms of what you do in general, what a day kind of looks like for you in your current role?
So it's a little bit different right now because of COVID, but I think everything is a little bit different right now.
Of
But
course. Yep.
so in a nutshell, yeah. So I work for a long-term care pharmacy. I am a consultant pharmacist. So a long-term care pharmacy is really going to have two parts to it, or at least the company that I work at. So they have the operation side, which is your pharmacy that is filling the prescriptions and then they get shipped to the home. That is a very interesting, especially if you come from retail and then coming over to see the operations of it. It was like mind blowing to me how all of this works. I had no idea. So it's really interesting operationally. And then you have the consultant side. So what technically that I do is, and this depends on which state you're in. So I'm going to talk about North Carolina because that's where I am a consultant at. But in North Carolina, the regulations are that for someone who is in a skilled facility, a pharmacist must review their profile once a month. So every 30 days, their profile has to be reviewed. If they are in an assisted living facility, a pharmacist has to review their medications and their profile every 3 months. So basically, every month I do this part of it remotely. So remotely, I can go in, I see their profile, I see what medications they're on. I'm able to kind of look at their diabetes regimen, and I'm able to see what their blood sugars look like. Have we gotten a recent A1C? Do I need to request a new A1C for that patient? Is there a recommendation that I can have for that to help kind of improve their A1C or improve what their blood sugars look like? And you do that for really kind of every disease state. The other thing is there are regulations based on psychotropic medications. So it's what we call GDRs, which are gradual dose reductions. So the CMS, which is kind of the regulating body for facilities, you have to, so a patient is not necessarily put on an antidepressant or antipsychotic medication. There are rules and regulations within that. You have to make sure, have they been trialed on coming onto a lower dose, that type of thing. So I manage that piece for the facilities as well to make sure that we're doing those trials or we're documenting appropriately if that is not medically the correct thing to do for the patient. So I monitor all of that kind of regulatory pieces as well. So I make recommendations. It can be recommendations to the nursing kind of part of the facility. And then I also make recommendations to the physicians based off disease state and maybe, something that we can do to help improve that patient's medications. You're trying to reduce their, pharmacy load, all of those kind of things. It's much more clinical than what I did previously. So you do those type of reviews on a monthly basis. And then typically I also would go in and visit homes. And so at homes, I also want to make sure that the CMS regulations are being followed at the homes as well. So I'm looking to make sure that our med carts are correct. I'm looking to making sure that medications are being stored correctly in the med rooms. I can make sure that our delivery of medications to a patient is happening correct. So the actual administration to a patient. So really, if I relate it back to retail, which is what I know kind of best, is it's almost like in retail, your board of pharmacy is going to come in and do an audit of your pharmacy, right? So they're going to make sure that everything operationally is happening correctly, that the patient care is happening, that your compounding area, all of those things are to the standards of your state board of pharmacy. It's that same type of thing that I do in the facilities, but it's based off of CMS guidelines. But that's the best way that I kind of know to explain that actual in-facility thing. The other thing is that in consulting, the facility is really my customer. So it's a little bit different so the patient is my patient. So I'm reviewing their charts and they are my patient, but the facility is really my customer because the facility can choose who they use as their pharmacy partner. So I also want to be able to come in and troubleshoot for, are there any issues with the pharmacy? Is there anything that they don't understand? I just want to be a resource to them any way that I can. So like right now, a lot of that is around the vaccine. So we are not the first pharmacy partner coming in to actually administer the vaccine, but we are wanting to be a resource for all things as education. And, my role is to know as much about the vaccine and how this process is going to work for these homes so that they can contact me because they're already familiar with me and I can give them as much information as possible.
No, it's so many moving parts and so many pieces to the puzzle. I obviously I knew a portion of that, but when you go through the whole thing, it's like, wow, that's obviously very clinical and a lot of parts to that. So, it's thank you so much for explaining that especially for our listeners who may have an interest in transitioning into something like that. It sounds like it may be a good time. And in terms of if anyone has questions for you, to reach out to you, what would be the best way to contact you to ask any questions about what you do or anything along those lines?
So I'm pretty easy to find. Again, my name is Lynsie Wokasch. I am on Facebook, I'm on LinkedIn, I'm on Instagram. You can find me on really kind of all of the social media platforms. Obviously through Happy PharmD, you can find me there as well, and really just reach out. Again, my heart is with being able to help pharmacists. And, so for any questions or anything, like if I can fit you in, or I will find a time to be able to kind of fit in to talk to anybody about maybe my transition, maybe my experience with coaching, or even what my current role is.
Awesome. No, thank you so much. It was a pleasure, and thanks so much for being on the episode with me. I appreciate it.
Thanks for having me.
Absolutely. Hey everyone, and thank you so much for joining us again in another episode of the Happy PharmD podcast. I hope you got a lot of valuable information, especially learning more about making a transition into a long-term care health facility as a pharmacist. Please feel free to reach out to us with any questions, especially if this does sound like a transition that you are interested in, or possibly a potential pharmacist role from what you are currently doing and are very interested in learning more about what a long-term care pharmacist does. Thank you guys again so much for joining us today on this episode, and we'll see you next time.